Well, I was diagnosed with HIV in 2003, and I learned in 2012 from my doctor that because my HIV was undetectable, I couldn't transmit HIV. So I was so excited. It really changed my life, but I learned that millions of other people weren't being told, and every HIV information site was saying that even when you're undetectable, you're still at risk of transmitting HIV to your partners. So I started this to clear up that confusion about HIV transmission and make sure the science of HIV transmission was reaching the people and the field that it was meant to benefit. The campaign is focused on changing the definition of the risk of transmission. So the risk was very outdated, pretty much all over the world, and our job was to get together with the researchers and create a consensus that there is no risk when you're undetectable. You can't transmit HIV sexually when you're undetectable and you're on ART. So, and then the goal was to work with partners to build a critical mass of influencers in various countries that would confirm this was true, and eventually that would shape the conversation about what it means to live with HIV. And that's important because that reduces the stigma of having HIV, the internal stigma, the clinical stigma, and the community stigma that people face. It also encourages people to start treatment and stay on treatment for their own health, and also to prevent transmission to others. And it's another very strong public health argument for access to treatment and viral load testing, so that everyone has the opportunity to be on treatment for our own health and to prevent new transmissions, which will get us closer to ending the epidemic. We started with a handful of organizations in New York, really, in the United States, with New York City and a couple of organizations, and it's now almost 450 organizations in 63 countries. U=U has been translated into 15 languages. The way that we did that was through partnerships. We just kept talking to people, presenting the campaign, presenting the science. So major turning point in going international, I think what really was Katie in Canada, AIDS Map in the UK, IAS, ICASO, a few groups in January and February signed on, and it brought international attention to the campaign because of the large networks. The United States, I think our greatest accomplishment working with the U.S. government was the U.S. Centers for Disease Control updated their messaging on risk to say that a person with HIV who is on antiretroviral treatment and is virally suppressed or undetectable has effectively no risk of transmitting HIV to their sexual partners. So we were thrilled about that change, and that changes everything because there are many organizations that depend on the CDC for their communications. We're seeing that in other places around the world as well through our very strong partnerships around the world. At IAS, and this past summer in Paris, UNAIDS confirmed their agreement with the message, and they issued an explainer saying, do not people who have an undetectable viral load, a sustained viral load, do not transmit. So UNAIDS has come on. Well, I should also say the city of Paris, the city of London, the city of Chicago, New York State, major states in the United States, New York State, Michigan State, Minnesota State, Washington, D.C., our nation's capital, has U=U campaigns on buses and billboards. So there's been so many really exciting successes and partnerships. What's our next step is to continue to work through our partners to help support them. There's over 400 around the world. Some are really struggling and don't have the resources to create campaigns or need help with strategies for approaching their NGOs or federal governments, or they need support with how to advocate. Use U=U for advocacy for viral load testing and treatment. 3 to 5 years, and then we don't need the campaign anymore because the message will be integrated into all the these various partners into their programs, into clinical and communications practice. We have a lot more work to do because millions of people still don't know and they're being told the wrong thing. And if we're serious about ending stigma and we're serious about ending the epidemic, we will make sure that everyone knows. People with HIV, policymakers, and the public all need to know this.